Hello, I'm very happy to be joining you from Athens at the headquarters of Doctors of the World here in this beautiful city. Today I'm joined by two guests, Dr. Kostis Prouskas, Chairman and CEO at Aktios Elderly Care Units, and also a consultant and advisor to the Tima Foundation, with which the Hellenic Initiative Canada is working on a program in support of the elderly in Greece. Joining Dr. Prouskas today is Dr. Athina Greka, a pathologist and gerontologist, and involved with the program 60 Plus of Doctors of the World. We at THI Canada believe that support to programs dealing with the elderly in Greece is a very, very important part of our activities. And today we'll be speaking not only about the situation facing the elderly in Greece, but also a program that we believe is making a real difference at the grassroots here in Greece. So I'd like to welcome first Dr. Prouskas this morning. It is morning here in Athens. Dr. Prouskas, you have a very long experience working with the elderly here in Greece. We know that in countries around the world, particularly during COVID, some of the cracks and impacts of COVID have become much more apparent. In all of our countries, we are facing an aging demographic. We know that the challenges facing the elderly are not unique to Greece. But let me start by asking you to give an overview of the situation facing elderly in Greece from your perspective.
You mean, first of all, I'm very happy to be here. Would you like me to talk about the COVID period, or would you like me to say something more general?
Well, obviously COVID has had a big impact on the elderly, but the entire population, frankly. But perhaps you could start by talking about the challenges facing the elderly in Greece, and perhaps a parenthesis on how COVID has impacted the elderly.
First of all, when we're talking about elderly people in Greece, we're talking about a big segment of the population. So many people are over the age of 60 or 65, and that creates a demographic challenge on its own. And even though elderly people are considered to be of high esteem in Greece, they are also accompanied by a negative connotation. And this is due to the fact that we do not have very well developed services as far as health and social welfare is concerned in Greece. Greece went through major crises and wars during the previous century and did not have the time or the political decision to organize and develop the welfare states in the same way that other European countries did. So basically the care of the elderly people in Greece is supported, is undertaken mainly by the family. So when we talk about any kind of disability or cognitive decline, we have to have a family member who will accompany and work together with the elderly people. The elderly people went also through another major challenge in the last decade, and that would be the economic crisis. The constant decrease of their income, which was an easy but very unfair solution to combat the economic crisis, created vast inequalities and created a large number of people who were under the idea that they had their future organized through a respectable income to go far beyond that expected income. So that also created issues, and together with the lack of services and support, our fragile elderly people became very, very disadvantaged. So more or less that is the general impression that we have about elderly people in Greece. However, there are some organizations and some movements trying to introduce the notion of healthy aging. There are some organizations that are trying to support the idea of having more services for elderly people who are in a disadvantage, like who have dementia, for example. And the experience that we had with the COVID was, of course, it was negative as it was in all countries, but it was also an opportunity. because in Greece we did not have the negative impact in nursing homes that we had in other European and countries of the developed world. We had a sector that closed its doors quite early, put on masks and all the necessary protective equipment, and managed to keep COVID-19 and its negative, deadly consequences away from our long-term care. So we had a very successful example in the long-term care facilities for elderly people in Greece, as far as this is concerned, with minimal deaths and just a few cases compared to the general population, and of course compared to the population of elderly people in nursing homes.
Dr. Prouskos, you perhaps could talk a little bit about a typical family in Greece who may have an elderly member of their family. If that elderly person becomes ill or unfortunately has dementia, what support can that family expect from the Greek state? I'm just trying to get a better understanding of the types of services or lack thereof in the Greek context for families in that situation.
First of all, we need to refer to the notion of reciprocity, which is a basic notion in the operation of the Greek family. So younger members are supported by the older members of the family when they are children, when they are studying, when they are freshly wed, and then it is part of their obligation to care for the more elderly or disabled members of the family. So this is the way the system has been organized in the last hundreds of years, and we see that this pattern continues even now that the family is smaller, because this plays an important part. When families were bigger, there were more members to care. Now we might have two young individuals taking care of 4 elderly members. And of course this creates other social and economic issues, and also a psychological burden. The truth is that we do not have any services for the support of the family that supports elderly people in a disadvantaged condition. We have a few daycare centers for dementia that are taking important steps towards cognitive reinforcement and maintaining some kind of training, cognitive training for elderly people with dementia. We do have the old CAPIs that are working as social clubs, but that also do not support a family that has someone with an illness. We have a disorganized health system, unfortunately, and no family practitioners. So I'm sad to say that we do not have the support that the family needs or deserves in these difficult situations.
Perhaps you could just talk about conversations that are taking place in Greece to address some of these problems. Is there a discussion at various levels of government, for example, to address some of these issues? If I've understood you correctly, the model that had been working for a long time, particularly as young people during the economic crisis moved away, I expect that some families were even more vulnerable because that support was not present. But I think some of our listeners today or viewers would be interested in understanding whether there is a discussion going on in Greece about how to address some of these issues.
We're trying, as several NGOs and foundations like TIMA, we're trying to introduce this discussion. And we haven't been very successful in the past years. We do not see the willingness from any government to take on the issue of elderly people or people over the age of 50 who are preparing to become retired and then become elderly, because probably there is no knowledge, or there are bureaucratic obstacles, barriers. I think that the problem starts from the fact that we have a small office for the protection of the family and elderly people, which was moved sometime, like some years ago, through a Troika mandate. It was used to the Ministry of Labour. So the government realized only recently that this office has the responsibility for all the population, for all the elderly population, as well as the long-term care facilities for the elderly people. And of course, this office is not enough, it's not adequate to undertake such responsibilities. So there is, first of all, a strong need to reorganize the way the system is set. We propose a healthy aging secretariat in the Ministry of Labour, which would address all issues of the people over the age of 50 that have to do with employment, with early retirement, with retraining needs, etc. And of course, with all the healthy aging activities that need to be undertaken, but also the movement to the Ministry of Health of the sector that concerns the elderly care facilities. And I need to say here that in Greece we do not have any public elderly care units. Elderly care units in Greece are private, for-profit or non-for-profit. The government operates a few, below the number of 50, less than 50 units that are called social care units that are not particularly addressed to elderly people, but to all people that need social support. And of course, they are not enough. They don't have many positions for elderly people, and they are just a tiny number compared to the about 15,000 beds that we have in the elderly care sector. And also, there's no support for any person who would like to go into a long-term care facility.
Difficult.
Yes.
My understanding is that gerontology as a profession in Greece is a relatively new concept. So perhaps you could elaborate a bit on that. But also, there is not a professional certification for what we would know in the Canadian context as personal support workers. I wonder if you could comment on both of those points.
Yes, we do not have any formal education in gerontology up until this year, if I'm not mistaken. We tried in the past to introduce some courses in the National School of Public Health, but it didn't work. There are some courses in gerontology, 1 or 2 courses in the schools of social work, psychology, and nursing. We do not have a geriatric specialty. We only recently started a master's in gerontology in the University of Athens. And of course, this is not enough, and it does not promote the study of aging in the way that an aging society, as the Greek society, would need.
And what about personal support workers?
There we have even worse news. We do not have a qualification for personal support worker. We tried through European programs, Erasmus programs, founded by institutions, to operate training programs for people who would like to go into personal support. It does not work. It does not work because these programs do not provide any professional qualification, and people would prefer to go into a nursing assistant qualification. And also it does not work because Greeks, and as most Europeans, do not want to go into the personal support worker profession. They provide care for their family members, but they are hesitant in providing care for others. So if we want to address this issue, then we would need to go to our pool of refugees and immigrants, and it would require not only training in the caring profession, but also training in the local language.
Mm-hmm. So what you're telling me, if I understand well, is that a Greek family, assuming they could afford it, their recourse for extra help for an aging relative would be to find probably someone who is in Greece, perhaps on a temporary basis, or was a newly arrived person, and they would largely be untrained.
Yes, exactly what I say.
Thank you for the clarification. It's now my pleasure to introduce Dr. Athina Greka, a pathologist and a gerontologist. who is with Doctors of the World. I want to say how happy we are at THI Canada to be collaborating with Doctors of the World. We are in great admiration of the work that you do here in Greece and elsewhere, but the importance of the work you do at the grassroots level. So, Dr. Greca, perhaps I could ask you to talk about the 60 Plus program, but in complementing what Dr. Pruska said, I know that you have a very interesting perspective from your vantage point here at Doctors of the World. Welcome.
Welcome. Thank you for being here, and it's an honor for us, MDM Greece, the support of THI Canada for these programs and the other programs. This is a very special and sensitive program about the elderly people. Because it's an emergency intervention program for vulnerable people, healthy aging 60 plus. As Dr. Pruska tells us, the elderly has a very bad situation here in Greece about their health care and their social care. And I think and I believe that the health is a good that combines the absence of disease and disability with simultaneous physical and emotional well-being of the individual. The quality of life is identified when a state of happiness is composed from the balance of the following parameters: the functional state of the individual, the physical symptoms, the emotional world, the completeness of the cognitive function, and finally the existence of maintenance of social relation. Seniors are the most vulnerable of the situation that upset this balance and these parameters. So with this program, we take care about their health and their psychological and then social state.
It's a holistic approach.
It's an holistic program, and it's very good that we have the support of THI, of TIMA. It's very good for us because these programs are not have a progress if we have not a supporter.
No, it's very, very helpful. I think a focus on a holistic approach to the elderly is doubly important. And we're very, very happy to be both involved, working with TIMA, working with Doctors of the World, to ensure that this program not only survives but grows, hopefully, in Greece. Perhaps you could talk specifically a little bit about how the 60 Plus program works, and for our viewers, because it's, I think, a very novel and unique way that was even more relevant during the COVID period, because all of us were more isolated because of lockdowns and so on, but it provided a lifeline, I'm sure, to many isolated seniors.
Yes, this program is not it starts from the period of the COVID pandemic, but I don't think that it's a program for the pandemic of COVID-19. Right. It's a program for the isolation of the elderly, and I will show you later a presentation about the programs with photographs and a small film that we have prepared. Because the isolated people and the people who can't because of the low pension after retirement, the high living cost of life, they have the possibility and suffer from the specialized medical care. Mm-hmm. So door to door, and we go to any home of our patients to take care of them. I have to say that in this program only us, the Doctor of the World, comes to homes to take care of the patients because of COVID-19. And also the other steps of this program is the online society we will see later, and psychological support, and about social worker position.
if I were to ask you what you see as the biggest challenge for the elderly in the work that you do, what would that be?
No one, I think that no one has to be isolated.
Isolation. Yeah.
The isolation is the problem of the whole elderly, the society of elderly, and not to be able to visit a doctor, to visit their families, their children, is a very big problem, and it is not the problem of the pandemic. This is not the problem of the pandemic 19. It's a problem of the whole society, I think, in the whole world.
Yes. I think so. Maybe you could talk a little bit about the common medical problems that you see in your work. What are the most common medical issues facing many of the people you visit in their homes?
We have patients with serious problems, with diabetes, with dementia, with hypertension. The special problem is that they can take the treatment, so we have to give medicine from their therapies. They're not able to go to a doctor.
Yeah.
So they have there is the necessity to be there.
Yes, yes. Yeah.
Anytime, everywhere. In whole Greece, and not in Athens, because we go and to the countries and to the cities of the fire, like Evia, in the whole country.
Yeah. I have a question that is very common in many countries, and often we separate dental care from medical care. And to me, dental care is fundamental to overall well-being. How are issues related to the elderly and dental care addressed? Maybe it doesn't fit within your remit, but often dental problems can create very, very serious medical problems. And I just wondered how Doctors of the World collaborates maybe with others, or how you would deal with an elderly person who has very, very serious dental problems.
We have here in MDM Greece in doctor office for the general problem of the elderly, but we have a dental support from the elderly, and not only from the elderly, but the elderly especially, because the dental problems are very serious in these people, with blood sugar high, with any other problem, with osteopenia, with so much problems.
Yes.
Medical problems.
Yes, yes. No, it's a serious issue. And again, when you talk about a holistic approach, you can't really separate dental issues from overall medical issues.
I think that the elderly needs to take care, to have to take care from a group of specialists, like doctors, gerontologists, like social workers, like psychologists, like dentists, like nurses,
yes,
like home care.
Yes, yes, yes.
And their families, of course.
Of course. I think you're going to show us a little video in a moment, but maybe I could just ask a final question, and Dr. Pruskas, feel free to jump in and comment on anything that Dr. Greca has said. But what about prevention? Are there efforts by Doctors of the World to actually educate seniors on best practices, on things that they can do to improve their health? Maybe you could. We all would like to avoid getting ill, so there are certain things that we can do to avoid getting sick. So I wondered if that's part of your mandate as well.
Yes, we have volunteers here in the MDM Greece and at the doctor's office downstairs, and we educate them about and doctors and nurses and other specialties. But MDM Greece is it's an organization that I think that you have to have the feeling to do this. That is the
passion. You have to have
that is
passion.
the most important, because a job we all do a job, but if you have no passion to do something, I think that volunteering no exists.
I agree. Dr. Priscos, would you like to comment on some of the things?
Yes, I would like to mention a specific program that was introduced through the Ministry of Health some years ago. It was introduced by the Hellenic Gerontological and Geriatric Society. It was called the EPIONI, and its purpose was to circulate and publicize activities on prevention of certain health issues. So we had years that were dedicated in diabetes, in dementia and cognitive function, in the prevention of falls, in the prevention of obesity, in the prevention of cancer and respiratory diseases. This program was interrupted a few days ago.
May I ask why the program was interrupted?
It was a decision from the government, from the Ministry of Health.
I see.
It's very bad to start a program and then
it has been running for years, and it was a perfect example of how the ministry can work with all the regional authorities, the health regional authorities, and start activities that have to do with health prevention, which is something that we are missing in Greece.
Yes.
And unfortunately, it was interrupted after many years of operation.
Yeah. Thank you for that clarification. Dr. Greca, maybe you would like to introduce the video, and I think we're going to have actually an online conversation later with one of the beneficiaries of the 60 Plus program.
Okay. I will give you a presentation about the program, which is this program of Doctors of the World with the support of THI Canada and TIMA. It is in the Healthy Aging Emergency Intervention Program of Vulnerable People 60 Plus. And next, please. And this is, we have photos there from the people. Doctors of the World continues for the second year the emergency response action against the COVID-19 pandemic, providing medical and psychological support to society and financing vulnerable elderly people who, due to restrictive measures of the protection of public health and are even more isolated. And the next, please. And this is our actions, door-to-door visits, continuation of the pilot program of online society for the elderly, and remote counseling or psychological support. Next, please. And the age of 60s, that's the age of retirement. The patient is considered and treated as a geriatric. This is the problem. And in this context, MDM Greece implements the program Healthy Age 60 Plus. The elderly are isolated, and not only from the COVID pandemic, but from the other situation. Please, the next. Through this program, elderly persons receive medical care, social support, and counseling specialized to their needs. Specifically, persons over 60 years old receive geriatric medical treatment and pharmaceutical support. This is from the fires in Mati. They are also providing the specialized psychological support and counseling. The majority of the cases face issues are related to the loss of their partners. And next, please. And this is an old man, 92 years old, who is a bedridden elderly person with low income pensioners in this group. But the other group are the seniors with a serious health problem and serious without supporting environment. And now is the program door to door, a part of the program, to give treatment and medicine to the elderly people with a team of a social worker, a doctor, a psychologist, a nurse, a door-to-door free medical assistance through the execution of electronic prescription in collaboration as well with the appropriate referral by the social services of municipalities, Athens and Piraeus and Perama and Keratsini, but also remote communication with the beneficiaries from psychological supported sessions. And also through the application of online society, we are very proud from this program. It's a pilot program and we are very proud for this. A group of elderly people coordinates weekly with a psychologist and the geriatrician of the program, where they attend the presentation and participate in the discussion on issues related to the elderly. This is photos of the program. And they try. And of course, exercise is medicine. We try about exercise. And next, please. And this is the online society. Happy faces and lovely people. And the goal is to create virtual groups under the guidance of a specialist doctor, of a social worker and psychologist. This is not, there's not therapeutical groups. These are groups with a discussion about issues that elderly people want to talk. And the technological means being used are simple, suitable for the elderly people. And the next, please. And this is photographs from the program. Christmas wishes in the left, and grandmother with 90 years old. This is another photo that speaks about how about your story and how about your experience in your life. Do you want huge? And they try. Over there, they try to connect and to speak in the tablet. And this is that we are very, very proud of this program. It's the medical support. This is a special service that we have offered to the participants, examined using biological impedance analysis, BIA. The body composition, particularly body and fat and mass. The body composition is important for the prevention of injuries caused by falls and trips. And next, please. And during the program, we organize webinars open to the public. And next, please. This is like needs and similarities and difference of children and elderly. Many commons and many differences. Mm-hmm. And the next, please, the effect of music. We have the participant of famous pianist Misidora Pakopoulou here. And thank you very much. And if you want, we will see a video about the online society.
Καλημέρα. Λέγομαι Σωτηροπούλου Βασιλική. Εγώ είμαι η Γεωργία Καρβέλη. Ευχαριστώ πάρα πολύ για την πρόσκληση στο πρόγραμμα, γιατί είμαι πάρα πολύ όμορφο.
Ευχαριστούμε πάρα πολύ. Εγώ ονομάζομαι Ευγενία Θάνου, είμαι η Γενική Διευθύντρια των Γιατρών του Κόσμου.
COVID-19. Μια κρίση που ξεσπά ξαφνικά. Μια κρίση που επηρεάζει όλους μας. Και περισσότερο επηρεάζει τους ηλικιωμένους ανθρώπους. Αποφασίσαμε να δημιουργήσουμε τη διαδικτυακή συντροφιά. Ένα πρόγραμμα το οποίο μέσω υπολογιστών βρισκόμαστε κοντά στους ανθρώπους που μας έχουν ανάγκη, κοντά στους ασθενείς μας.
Καλημέρα σας, τι κάνετε, κι άλλο στην παρέα. Καλά, ευχαριστώ, εσείς.
Πώς περάσατε σήμερα?
Πάρα πολύ ωραία.
Τι κάνατε από το πρωί?
Ήσυχα, ηρέματα, καθιερωμένα.
Δηλαδή?
Σκεφτήκαμε έναν έναν τους ηλικιωμένους στο σπίτι τους, ώστε να τους εξηγήσουμε τον τρόπο λειτουργίας και γενικά όλη τη δομή του προγράμματος. Αυτό που εμένα με εξέπληξε πραγματικά θετικά ήταν ότι όλοι είχαν ιδέα από τα τάμπλετ. Και αυτό που είπαμε ότι το χρησιμοποίησαν παραπάνω στην εποχή της καραντίνας, ώστε να μιλάνε με τα παιδιά τους κυρίως.
Τα παιδιά μου βρίσκονται μακριά. Το καλό είναι ότι επικοινωνούμε μαζί πρωί και βράδυ.
Οι άνθρωποι αυτοί απομονωμένοι στα σπίτια τους, μακριά από τις οικογένειες και τα αγαπημένα πρόσωπά τους, ξαφνικά αισθάνθηκαν έντονα συναισθήματα μοναξιάς και απομόνωσης.
Το θέμα είναι ότι τώρα με τον κορονοϊό μου λείψανε πολύ από την γονάκια μου.
Χαίρομαι πάρα πολύ για αυτό το πρόγραμμα, για εμάς που είμαστε στο σπίτι να πούμε και κάτι άλλο.
Το πρόγραμμα δημιούργησε μια διαδικτυακή παρέα που ενώ ήμασταν τόσο πολύ μακριά, παράλληλα ήμασταν και τόσο πολύ κοντά. Οπότε οι ηλικιωμένοι περίμεναν με μεγάλη ανυπομονησία τη μέρα και την ώρα που θα ερχόταν τόσο κάποιος μες στο σπίτι τους να τους μοβεδιάσουμε πολλά πράγματα.
Περάσατε σήμερα?
Ελευθέριο στις 6 ώρα που μπορώ χωρίς συμπιτή.
9 η ώρα θα σηκωθεί ο άντρας μου, εκεί πίνουμε το γάλα μας, τον καφέ μας.
Ντομάτες! Στον κήπο σας?
Από τον κήπο.
Τι καλό μαγειρέψατε σήμερα?
Έκανα πυριά.
Όσο σας φαίνεται παράξενο, για μένα είναι πιο δύσκολη η μακαρονάδα μια φορά στη ζωή μου. φτιάξει μακαρονάδα. Η γυναίκα μου την έχασα το 2009. Από εκεί και μετά φύγανε και τα παιδιά μου στην Αμερική και πρέπει κάπως να την βιώσω. Λίγο πολύ τα έχω καταφέρει.
Την άλλη εβδομάδα θα κόψω τα πρώτα μου αγκουράκια.
Εγώ τα έκοψα χθες, τα αγκουράκια μου.
Παρότι λοιπόν ο COVID μας απαγορεύει την επαφή στην καθημερινότητά μας, εμείς βρήκαμε τον τρόπο να την διατηρήσουμε αυτή την επαφή. Αυτό είναι πολύ σημαντικό μέσα από αυτό το πρόγραμμα.
We are very proud for this program and thank you very much.
Congratulations. I have to admit it was very moving to watch and it really brings out the importance of this program and may we be able to build on the success of this program and continue it. Maybe I could just ask a brief question. How many participants are there in the program and what is the scope for others who are not in the program to be part of it? How do you select participants or how do participants become involved?
There are 10 participants. Now there are 20 participants. We have to educate them with tablets. They all don't know the IT technologies, the new technologies, but they try because they have to communicate with their children, their families, with us. And this is the difficulties of the program, and the internet, that it was not very good everywhere in all homes. And we wanted to continue this, not only from the COVID-19 pandemic. We prefer people not about this economical situation, but about how isolated they are. This is the criteria to do all this.
That's very interesting. Well, I understand we're actually going to go from the video to speaking to someone who is part of the program and who is waiting to speak to us online. So, Dr. Greka and Dr. Pruskas, perhaps I could turn things over to you and introduce our very important guest who is on the monitor this morning.
Thank you very much. Κύριε Γιάννη, καλημέρα.
Καλημέρα.
Ο κύριος Γιάννης, Mr. Γιάννης is a participant of the program of the Healthy Aging 60+. And he will talk about this. If you like all this, if you like the program, or no.
No.
Καλημέρα, κύριε Γιάννη.
This is Mr. Pruskas, and this is Mr. Peck.
I admit that when I first heard about it, I was a little bit unsure of it. I mean, the idea of totally different backgrounds merging together on an online situation was a bit strange to me. But it turned out much, much better than I expected. The learning curve for everybody seemed to be quite quick in terms of using the tablets. So after a few sort of teething problems, everybody was just using the technology without it being the main issue. Then we were just another big group of talking to each other as if we were having a morning coffee clash, at the local coffee shop or something. It was interesting to see how, despite different backgrounds and different histories that brought us all to the point where we are, the common denominator to everybody was that everybody needed to talk to somebody who was experiencing similar problems, or not necessarily problems, but situations. And I do believe that after, what is it now, more than a year of this, it has gotten to the point where we're a very tightly knit community. For example, one of our group is currently visiting his children in Vancouver and Pittsburgh. And already we have the contacts through social media between ourselves, exchanging pictures from his trip, talking about how he's doing and so on, just like you would with anybody other friend that you would have in quote real unquote life. The work from the doctors of the world has been very important, but also at the same time very discreet. Um, you don't have the usual sort of a parenting attitude that, well, now that you're not able to do so much for yourself, this is what you need to do because we know better. That does not exist. It's more or less another member of the family caring for you and suggesting things that might be good for you, but never pushing and always listening in case there are special circumstances that need to modify the measures that they think would be good for you. Um, and I think this has been a very big factor contributing to the success of the program. So, all in all, I'm extremely pleased and I think privileged to be a member of this community. And if you have any questions, I'd be more than happy to answer them.
Yanis, what has this program meant for you personally, given your circumstances and your reality?
Well, considering that originally I met the Doctors of the World through a problem I had with some old injuries in my legs, which made moving around very difficult for me. And again, impacting the quality of my life without being able to meet all my friends and so on. And also because of finances and the huge crisis that we went through, I really didn't have proper access to the right medical care. So they were really a lifesaver in this aspect as far as I was concerned. And the sort of internet fellowship was like the icing on the cake for all of this. But then it took on a life of its own and blossomed in a way. The nice thing is that for me personally, I have made a number of new friends. Um, Always ready to help if I can, but also to learn a lot. And there is a feeling of belonging, not necessarily replacing family ties or old friendships, but rather enhancing them with creating a new source of discussion with my friends and my family, again through social media and the internet and whatnot. Uh, and I think you get a cascade effect of these benefits going way beyond the original Doctors of the World tightly sort of targeted group.
Yanni, you are speaking rather to many Greeks in the diaspora, and I wondered if you would like to basically send a message drawing from what you've just said about what the program has meant to you in Greek, so that your fellow citizens in Canada and around the world can hear it από καρδιάς, what you just said in English.
Από καρδιάς πάντα ήταν και όλα αυτά που είπα πριν.
Ξέρω.
Και βασικά ήθελα να πω ότι αυτό το πρόγραμμα με βοήθησε πάρα πολύ προσωπικά στο να μετριάσει και σχεδόν να εκλείψει την απομόνωση στην οποία θα είχα περιέλθει και λόγω προβλημάτων υγείας προσωπικών, αλλά και λόγω της όλης κατάστασης με τον COVID και όλα τα παρελκόμενα. Και στην αρχή ομολογώ ότι ήμουν λιγάκι σκεπτικός, αλλά η επιτυχία του ήταν τέτοια που εξέπληξε και εμένα πάρα πολύ ευχάριστα. Έχει δημιουργηθεί μια σχεδόν δεύτερη οικογένεια, να την πούμε έτσι, μεταξύ μας, με όλα τα ενδιαφέροντα νέα της οικογένειας, μαθαίνεις τι γίνεται, ανησυχείς για κάποιον, κάποιος βοηθάει τον άλλον και ούτω καθεξής. Και έχει δέσει, δεν είναι κάτι απομονωμένο, είναι τόσο ζωντανό που δένει και με την υπόλοιπη προσωπική μου οικογένεια και φίλους. Παραδείγματος χάρη, προχθές μιλούσα με φίλους μέσω του Skype και από τα πρώτα νέα είναι «Α, και να σου πω τι έγινε προχθές την Παρασκευή που είχαμε το meeting Δηλαδή αυτό παίρνει μια ζωή τελείως έξω πλέον από το κλειστό κύκλωμα, να το πούμε έτσι, των γιατρών του κόσμου.
Σας ευχαριστώ πάρα πολύ, Yanni. Even with my limited Greek, I understood very, very clearly what you said, and I felt the emotion with which you said it. So thank you very, very, very much. I wondered, before we close this very interesting session, whether Dr. Greca or Dr. Pruskas would like to add any final thoughts to our conversation today, and any messages that you would like to underscore or reiterate to viewers in Canada and perhaps elsewhere who would like to support this very, very important program.
I think I'm very proud, and me personally, and MDM Greece for this program. And I think that the future of the geriatrics in the whole world is the individual care of each patient or of each person. This is the situation that we have to take care and to upgrade qualities, not only for medical care and for social care and for psychological care for these people, and to limit the isolation that they have in the society.
Thank you. Dr. Pruskas?
Well, I would like to say that isolation is an issue with senior citizens, and we see that life circumstances contribute to that, because friends, family members are lost, and you don't have all the opportunities that you had when you were younger to create new relationships and new friendships. This became even worse with the COVID pandemic. Especially in Greece, elderly people backed up. They stayed at home and they provided the terrain to everybody else to move and work and operate, and they stayed at home to be protected. But this caused isolation, and it's very good that we have organizations such as the Doctors of the World to provide these kind of interventions, and it would be good if this was an example and a pilot to a wider program that could be implemented in Greece.
Well, it's my duty now to thank Dr. Greca and Dr. Pruskas for being present today. I'd like to thank the team at Doctors of the World. I'd like to thank our partners at TIMA. This is the first time THI Canada has had the opportunity to partner with TIMA, and we hope that this will be only the beginning of a future collaboration. I'd also be remiss if I didn't thank the Delphi Forum and Simeon Somokos SA for providing the technical support and facilities today. And on that note, goodbye from Athens, and until the next time.